Welcome to Workplace Safety Screening's Intercept Oral Fluid Drug Test Collector Training. This video will cover the Intercept Oral Specimen Collection Device, collection preparation, the step-by-step collection procedure, and a few WSS tips. Over the years, WSS has completed thousands of oral fluid collections and have found a few common mistakes, which we want to ensure that your collection site avoids. Specifically, sealing the sample, collection time, and wait time. The collection device consists of two parts: the collection pad and the specimen vial. The collection pad is designed to collect oral fluid from between the lower cheek and gum. The white pad contains low levels of common salts to help generate oral fluid. The device has an easy-to-grip handle with the blue flag to help ensure the proper orientation of the pad in the lower cheek. Blue flag up equals correct orientation. The specimen vial contains a preservative solution which stabilizes the sample for shipment. The vial is designed to accommodate the tamper seal provided on the chain of custody. Oral fluid collection is an easy three-step procedure: swab, snap, and seal, across the top like any other drug test. Prior to beginning the collection, explain the procedure to the donor. Verify the donor's ID and ensure that the donor has had nothing in their mouth for at least 10 minutes. No eating, drinking, or chewing. If the donor has had anything in his or her mouth within the last 10 minutes, wait 10 minutes prior to beginning the collection process. If he or she removes tobacco from their mouth, make sure that they rinse with water before the 10-minute waiting period begins. If the donor has dentures, it is best practice that they brush their teeth before the 10-minute wait time begins. However, this is very sensitive. Therefore, it is best to simply ask them to rinse their mouths with water and then wait the 10 minutes. Have all the supplies on hand. This includes the Intercept collection device, the lab specimen bag, the chain of custody or CCF, a timer capable of timing at least 6 minutes. 6 minutes is the required time, no less. Any shipping supplies needed to get the sample to the lab. Before beginning the process, we must note that the entire collection procedure needs to be viewed by the donor and the collector all the way to the end. Never leave the donor alone with the pads in their mouths and walk away. Never let the donor walk away from you while you're performing the test. And as discussed before, make sure that the donor has had nothing in their mouth for at least 10 minutes and they stay with you all the way till the end. Have the donor choose two packages and check the expiration date on the Intercept collection device and open them. If the devices are expired, they can no longer be used. If expired packages are used, the sample will be rejected for testing. Turn the package so that it's facing upward. Open the package where indicated by peeling apart the two sides of the package far enough to allow easy removal of the pad. Do the same for the next package. Use the blue flag of the device to pull the pad out of the packaging sleeve. Do not touch the pad. And also be careful to not pull the pad off the device. Have the donor place the pad inside of their mouth between the lower gum and cheek with the white pad orientated down. Blue flag up equals correct orientation. Have the donor gently rub the white pad back and forth along the gum line until the pad is moist. This activates the device to enhance the collection of the oral fluid. After the pad is moist, leave the collection pad between their cheek and gums for 6 minutes. You can now start your timer. During the 6-minute collection, complete all sections of the laboratory chain of custody, minus the signatures, date, and time. After the 6 minutes, have the donor remove one of the pads. Hold the oral specimen vial in an upright positive and gently rock the cap back and forth to open the vial. Avoid spilling the blue liquid. Also avoid placing the vial on a hard surface as it can break the small tip at the other end. Have the donor gently insert one of the white pads into the blue liquid, pushing it all the way to the bottom of the vial while you hold it. Again, avoid spilling the blue liquid and avoid placing the vial on a hard surface as the donor could push down so hard it breaks the vial on the other side. Break the plastic shaft of the device by bending the shaft against the side of the vial in a direction away from people. The shaft is scored to make it easier to break. Place the cap onto the vial. The cap will snap into place when secured. Peel back the tamper evidence seal and place them across the top of the specimen vial and down to both sides. Never place the seal solely on the side of the vial, as this will not cover the top of the vial and the sample will be rejected for testing. Of course, always make sure you are not sending vials that are not sealed, as this will cancel the test. Vials need to be sealed correctly. This is very important. The donor will initial the vials and the collector will date them. Complete the chain of custody, ensuring everything is filled out correctly. Have the donor verify the CCF number on the seal and on the CCF form. Make sure that those numbers match. Place the sealed specimens and the CCF inside of the bag, folding the CCF so that the barcode is visible. Always place the seal of the bag over the lines as stated on the bag. Distribute remaining copies of the COC per company policy. Points to remember. Always double check your CCF and make sure that you have filled everything out correctly and thoroughly. Sealing the specimen is very important. If this is not done correctly, the lab will reject the sample for testing. Also, always remember the 10-minute waiting period. For more information, visit us at workplacesafetyscreenings.com. Thank you, and we'll see you next time.